Jane. How are you, dear? Come and sit in the chair, will you, dear? That's lovely. Now, we're going to put the bib on first, okay? And what we're going to do today is we're going to do that little filling for you, and we're going to do it in a very nice, special way. You've never had this before, so I want you to enjoy it.
Jane is having her first filling, but without a pain-killing injection. This film will show how patients, dentists and doctors are using hypnosis.
I'm so pleased, Jane, because this is all about imagination. Okay? So what I want you to do is, I want you to imagine that this little bit of cotton wool is a baby bunny, and this is a mummy bunny. And when I turn on the engine, they're going to go round and round and round. And you're going to see them going. Oh, there they go. Do you see them going round and round? Isn't that lovely? Listen, now I want you to pop your wee head back, and I want you to keep looking at these bunnies. And you're going to watch the bunnies going round and round and round. And very soon you're going to see a foxy chasing them. You're going to see a foxy. Let me know the moment you see a foxy. And the moment you see the fox, your left hand will go very, very light, and you'll lift it up for me and let me know. You'll let me know that the fox is there. And now I see your hand is beginning to lift. So just let it lift, your little left hand. That's lovely. Your left hand, how lovely. And you can see that lovely little foxy. Now what I want you to do for me is I want you to help me. I want you to help me to save the bunnies, because the bunnies there, they're hiding again, you see? I want you to help me save the bunnies. Because you can see the foxy chasing them now. Can you see the foxy chasing them now? That's lovely. What color is he?
He's brown.
Brown fox. Oh, the rascal, and he's chasing them, but we won't let him catch them, will we? We'll save those little bunnies, shall we? What I'm going to do, I'm going to blow some air into that little toothy of yours. And I'm going to blow some lovely happy air, because, you know, it makes a funny wee noise. And we're going to blow the air on the toothy, and that will clean out the little hole in your tooth, and we'll let the bunnies go into that little hole and hide. Shall we? Oh, shall we? Oh, how wonderful. There is, would you like to hold this for me, please? Thank you very much. And see, this is the little thing that blows the air. And it's going to blow a little bit of air into that. You see the air blowing, do you? You see the air blowing? Now I'm going to blow that air in your toothy. Are you ready to help the bunnies? That's lovely. Oh, the air was not strong. That's lovely. And you are going to help the little bunnies?
Although Jane appears to be fully awake, her imagination has been stimulated to produce a slight hypnotic state in which she does not feel pain.
Let's have another wee looky now. Let's have a look. Oh, you've done jolly well. You know that, Janie? Now keep looking at those lovely little bunnies now. And we're going to clean out all the dirt and all the rubbish out of that little hole. In this case, the cavity is fairly deep. It involves two surfaces of the tooth going from the biting surface right down to the level of the gum. Normally, this is fairly painful, and you're cutting through areas of where there's thousands of nerve endings, and it's not only painful, but it's very uncomfortable. That's lovely. Beautifully done. And now I'm just going to plonk this little bit of silver, and I'm going to press it in on top of the bunnies, because the bunnies are in it now. Now, that was beautiful. Did you enjoy that?
Yeah.
Did you? Was it fun? Mm-hmm. Tell me more about the foxy.
There's a big, bushy red tail.
A bushy red tail? Mm-hmm. And has he run away now? Mm-hmm. That's lovely, now that the bunnies are safe and sound. Mm-hmm. And did you enjoy that little help you gave them?
Yes.
And you'll have it again?
Yes.
And save some more bunnies?
Yes.
That's lovely. Thank you, darling girl. Just pop off the chair now. Thank you, dear. And we'll just walk back.
The dentist is Mr. George Fairfall Smith, a clinical assistant at the Glasgow Dental Hospital.
Bunnies, see? There you are. I use this regularly with children. I find it's very effective. It hardly ever fails. And they're very responsive, because at this particular age, they have a tremendous ability to Imagine, and this is the whole secret of this technique.
It's not only dentists who find hypnosis useful. We came here to Coventry, where parents bring their children to a family doctor who runs a hypnosis clinic. He treats problems ranging from anxiety states and school learning difficulties to asthma.
Just close your eyes, and I'd like you to imagine a very big balloon, a really big one, with very pretty stripes. What colour is your balloon, Julie?
Green.
And what colour are the stripes?
White.
Green with white stripes. That's a nice balloon. Paul, what colour is your balloon?
Blue.
And what colour are the stripes?
Yellow.
And Graham, what colour is your balloon?
Red.
And what colour are the stripes?
Black.
That's a good combination, red and black. And Simon, what colour is your balloon?
Blue.
And the stripes?
Red.
Jolly good. And Martin, what colour is your balloon?
Blue.
And the stripes?
Yellow.
Jolly good. Now you just imagine this very nice balloon with its stripes floating in a bucket of water right next to you. And I'm going to put your hand onto the balloon, and I want you to imagine that you are pressing the balloon down into the bucket of water, and you notice that the water pushes the balloon up, and of course it pushes your hand up. And then you press it down again, and the water pushes the balloon up, and it pushes your hand up. Quite a nice feeling. So, Paul, I'm putting your hand on the balloon. That's right. Now you keep playing with the balloon, down and up. That's good.
What I'm doing is distracting the children's attention from all that is going on around them by encouraging them to use their imagination to narrow down their attention onto one pleasurable, relaxing experience, playing with imaginary balls in imaginary buckets of water. And this produces a state of relaxation in which the child may look asleep, but is in fact physically relaxed and mentally very conscious and more sensitive than usual.
Pushing your hand up into the air. And now your hand is getting very heavy, so heavy. And as your hand sinks down beside you, so you get very dreamy and drowsy and heavy and sleepy. Such a lovely feeling. So sleepy you can have a dream now. You can dream that your balloon is at the seaside. It's on a beach, a very wide, clean beach. Lots of fresh air all around.
Children of this age may fidget and open their eyes, and this is natural, like fidgeting when Mummy reads a fairy story. But it doesn't mean that they are not hypnotized. In fact, they are becoming more involved in the story and mentally more deeply relaxed.
In a few seconds' time, when you hear me snap my fingers, you're going to dream that you're at home watching your favourite TV programme. What are you watching, Paul?
Match of the day.
Jolly good. You keep watching Match of the Day and more pictures will come. Julie, what are you watching?
Dallas.
Dallas. Well, you keep watching Dallas and more pictures will come. Graham, what are you watching? Tiswas. Keep watching that and more pictures will come. Simon, what are you watching?
Swap shop.
Keep watching that programme and more pictures will come. And Martin, what are you watching?
Grandstand.
Good. You keep watching that programme and more pictures will come.
When I suggest more pictures will come, their imagination can begin to take over. They are now much more relaxed, and the television show may begin to fade, and the children may start visualizing or projecting their own worries onto the TV screen. They may begin to see themselves solving their problems. Asthma patients imagining themselves running and breathing freely, or a child with learning difficulties may see itself performing better at school.
Paul, I'm touching you on the shoulder and calling your name, and so you listen to everything that I say to you.
Then I give them specific instructions with regard to their particular problems, and I also give a suggestion that they will not remember anything I say to the other children. Now, this ensures the confidentiality which should exist, even for children, between the patient and the therapist.
You're not going to worry about having severe attacks of hay fever anymore. And I'll go to sleep again and keep watching your TV programme. And you won't listen to me again until you hear me call your name. Simon, I touch you on the shoulder.
and I call your name, and you listen to everything that I say to you. Simon, you know that you're developing more and more control over your breathing difficulty, haven't you?
No.
You're not so frightened of having bad attacks, are you?
No.
I want you to imagine when I snap my fingers in a few seconds' time that you are having one of those bad attacks, and I want you to really show that you can control those attacks. That's good. That's wonderful. Feel a good feeling. That's grand. All your chest muscles relaxing. That's good. That's fine. And now really let it go. All the tightness falling onto the floor. Let it all go now. All gone. And now just relax. Feel a good feeling inside and outside. That's fine. And now you go on watching your TV program, and you won't listen to me again until you hear me call your name. Martin, I touch you on the shoulder and call your name, and you listen to everything that I say to you. You're not worried about those breathless attacks anymore, are you? By entering this very deep state of hypnotic relaxation, the tension within the child's system becomes dissipated. And lots of symptoms are concerned with tension, like bedwetting and asthma, tension in the lungs, and tension in the bladder. And because the sleep makes you happy, you're going to feel happier at school, happier at home, and happier with your friends. And in a few seconds' time, I'm going to count backwards from 10 to 1. And when I reach the count of 1, you come out of this sleep. And all the heaviness and all other strange feelings in your body will go away. And you will keep for yourself as much of this calm feeling as you need. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Well, how do you feel, Julie? And Paul, how do you feel?
All right, thank you.
Jolly good. And Graham, how do you feel?
All right, thank you.
That's fine. And Simon, how do you feel? And Martin, how do you feel?
All right, thank you.
That's good. You've all had hypnosis several times now. What do you feel is so very important about hypnosis? First of all, tell me, what are the things that I do or say that helps you to go into this special sleep of hypnosis?
It's the sound of your voice mainly, the way you sort of slur the words and speak really slowly.
I see. Do you enjoy entering hypnosis?
Yes.
What sort of feelings do you have when you're in hypnosis?
A happy feeling.
Very happy feelings.
Yes.
Do you feel as though you're asleep or having a dream?
Having a dream.
How did they describe their first session to you? What did Martin come back and tell you about it?
He didn't really say very much. He said, I saw a big balloon and it was very nice and I enjoyed it very much. But I'm not really going to tell you all about it, he said. He said, that was the nice part about it. He said, I did enjoy it and I do want to go again. And when he came out of Dr. Ibrahim's sitting room and into the waiting room, his eyes were alight as if, he'd just been to a party.
Did this seem to be a strange form of treatment?
No, not really. I was prepared to take any form of treatment, and I had every trust in the doctor. And really grateful for all the help he has given Simon to enable him now to live a more or less normal life.
I can run in races, which I didn't used to be able to do. Last year, for instance, I came second. I thought, oh no, I'm not going to make it. My chest is going to trouble me before I get to the end. But it didn't. I feel like a new boy, as if I'm got nothing to worry about. I'm fine.
To someone who's not seen an asthmatic attack that's really bad, could you describe them? Tell me just what they were like.
Well, yes, he would just draw in breath and wheeze terribly. You could hear him from one room to the other, his wheezing and the tightness. And if you picked him up, he was quite trembly with fright. It wasn't very pleasant to have to look after him like that, because there was very little that we could do without the aid of the doctor's injections.
Can you tell me about the first time you managed to calm an attack yourself?
Well, it was a Monday one day, and I was going to go to choir practice, and I'd come in from school, and I was tight, and so I did as the doctor told me by clenching my fist and letting the tightness run down my arm, and I sort of said, "Oh, it works," and it was really good.
What did you feel about that?
I felt really happy. It was very good. I didn't think it could work, but it did.
Don, how did you first get interested in hypnosis?
Well, this happened some 14 years ago. A 13-year-old boy came to my house and requested a visit, that I should come to see his father, who wasn't too good. Well, on that particular day, the boy lost his father and his mother. His father died during the night, and his mother went immediately psychotic. In fact, within hours of certifying the death of the boy's father, his mother had to be admitted to a psychiatric institute. And from that time onwards, he wet the bed every night. He moved out of my area, and I saw him some 3 years later when he was 16. And he'd moved back into this area to live with some relations. And I asked him whether he had any problems, and he said, yes, I still wet the bed, and I've wet the bed for 3 years. And I've had all sorts of tests and investigations by kidney specialists, bladder specialists, and I've seen psychiatrists. And they've told me it's simply because of my father and mother's my suddenly losing them. But I still can't stop myself from wetting the bed. And I said to him, well, the only thing that will be able to help you would be hypnosis. But I know nothing about it. And I rang London to see whether there were any people available, and there weren't any near Coventry, and of course there was nothing available on the National Health. So I told him to go away, and I said I'd read a book about hypnosis and see whether I could help him. Well, he returned 2 weeks later, and I used a very primitive technique from Price's textbook of medicine. And after 12 sessions, there was no improvement at all. And I said to him, well, look, hypnosis doesn't work. I'm terribly sorry, I'm not going to go on. And he said, no, please continue, because I'm feeling so much better. He said, I know I haven't got a dry bed to talk about, but please continue, and I did. By about, I think it was the 16th week, there was one dry bed, and by the 20th week, a total of about 5 months, he was completely dry. And he's now married with 2 sons, and he still looks at me with glazed eyes. Well, having had that experience, I then was convinced that there was something in this business of hypnosis. I then applied for membership of the British Society of Medical Hypnosis to make a proper study of it and to use it properly.
The Beth Israel Hospital in Boston, Massachusetts, is a major teaching hospital of Harvard University and one of the few medical centers to teach hypnosis. South African-born Dr. Frederick Frankel, professor of psychiatry, teaches doctors and psychologists how to hypnotize their patients. The act of concentrating on one pleasant idea is the first step in obtaining the type of deep relaxation in which hypnosis is usually achieved.
So the idea is to capture the attention and focus it specifically so that all other items become peripheral and less important. One of the ways in which perhaps to understand that is to consider what happens if you drive on a highway and you focus on an event that you've left behind you in your office or one that you're anticipating meeting when you get home. And you might drive for a mile or two and then say, I wonder whether I have passed such and such a landmark. And you can't remember whether you in fact drove past it or not, but obviously you have because you're past that point. Obviously you concentrated on your driving because you didn't land in an accident. In a sense, you put your motor car on automatic pilot, and so you had 2 parallel streams of consciousness going at the same time. What we know is that being able to be hypnotized is not universally distributed. If you really want to know whether somebody is going to experience hypnosis in a very rich way or whether it's going to be a less intense experience, the obvious way to find out is to hypnotize them. Caroline here has not been hypnotized before, is interested in the question of hypnosis, and so has kindly consented to join us today in order to see how her own experience, what her own experience of hypnosis is like. And we're very grateful for you, for your having come along. I want to just say a couple of things about this before we start. Firstly, you can be quite assured that I will not ask you in hypnosis to do anything that you wouldn't want to do. I will not ask you to confide in us in any way, any information or material that you consider to be private and personal. And of course, I will not ask you to do anything which is going to make you look foolish. I'm going to ask you to concentrate only on my voice as I continue to speak. My comments are intended specifically for you. They're not intended for the other members in the group, and this applies to people who will be watching this program on television. My comments are not intended for them, they're intended specifically for you, so that people who view this will not be affected by what I say, nor will they be interested in responding. But I'm going to ask you now, if you will, just to sit comfortably in the chair, preferably to uncross your legs, if you don't mind, and put your feet just side by side. Rest your hands very comfortably on the armrests, and preferably a hand on each side of your lap, like that. And just try and get as comfortable as you can. Is that all right?
Yes.
Right, okay. Just concentrate on my voice, and if you will, close your eyes at this point. And just feel yourself slowing down. Feel your whole body slowing down. Feel your breathing slowing down. And just feel generally a sense of comfort and relaxation and calm all through you. And you will find, as you continue to relax in this way, that you become especially sensitive to the feelings in your limbs and in your body. When people are in a very relaxed state, they sometimes can become aware of a light sensation which develops in the hands and the fingers and spreads to the forearm. Now, I'm not sure if this will happen in your situation, and if it does, I'm not sure when it will happen. I wonder even whether you know which hand is likely to be affected. But should you feel any sensation at all, as you imagine it, just allow that sensation to grow. Permit it to happen. As you focus attention and the feeling of lightness increases. Perhaps with a little assistance from me, the hand might feel as if it wants to move. That's fine. Just let it lift if that's what it wants to do. Just let the elbow bend as the hand and the forearm continue to lift up. Perhaps you can imagine that there's an elastic band attached to the back of your wrist. That's splendid. Let me just make the elbow comfortable. That's splendid. Just let the hand continue to rise right up into the upright position. Now, sometimes when the hand is in this upright position, it is just so comfortable and light, it feels like staying there. Perhaps at this point, without disturbing the trance, you might like to tell me how you feel. Are you feeling comfortable and relaxed at this point?
Yes.
The hand feels very light, does it?
Warm.
Warm. Fine. Are there any other feelings in the hand that you would like to tell us about?
Tingling.
Tingling. Fine. Sometimes when there are feelings like that in the hand, it might be difficult to put it back down on the armrest and keep it there unless I tell you that you can. I believe you're having difficulty putting it down at this point. All right, would you like to put it down?
Yes.
Fine, you can put it down then now. Just let it return to your lap. And as it does, the usual sensation and control will return to your hand and your forearm. And I'm now going to ask you, if you will, to cast your mind back over the course of your life and see if you can recall a very pleasant experience in your childhood. Is that a difficult suggestion for you to follow?
Yes,
It is.
too many.
Too many. Shall we focus on just 1 year, perhaps? If you could pick the 7th or the 8th or the 9th year, which one would you pick?
9th.
The 9th. Do you think that makes it a little easier for you?
Yes, yes.
Do you think you have a day now in
Yes.
the 9th year? Great. Now, you don't have to at all, but if you'd like to share it with us, that would be very nice. Do you feel you could? And don't feel in the least bit pressured to do so.
Yes. It was the day my sister was born.
It's the day your sister was born.
Yes.
That was a nice experience, was it? It's such an enjoyable experience, it's made you a little sad, has it?
Yes.
Sometimes when one's overwhelmed by feelings, that's what happens. How much do you think you'd like to share with us about what that was like? Or is it too intense for you to want to share it?
Well, she was early, so it was unexpected.
Yeah.
And in the morning, my mother had gone. Then at tea time, the baby come.
Can you see it in your mind's eye now?
No, only feel it.
Only feeling. Fine. Or do you want to stay with that, or would you sooner have
I don't want to stay with that.
No, okay. You've really done extraordinarily well. And we're very grateful to you. In a short while, I'm going to ask you to come out. I think that you've done extremely well. We're very pleased with the fact that you participated with us. I'm going to count back shortly from 3 to 1. And when I do, reach 1, you'll open your eyes and be wide awake. The usual sensation and control will return to your hands and your limbs. And you'll continue to feel relaxed and comfortable and have a feeling of well-being and achievement. You will remember as much of what took place in the situation as is comfortable for you to remember. In other words, you'll remember as much of what took place as you want to. But you'll find that when your eyes are wide open and you're wide awake, you'll feel comfortable and relaxed and have a feeling of well-being. On the backward count now, from 3 to 1, I'm going to ask you to wake up. 3, get ready. 2, roll up your eyes. And 1, open them. How'd you feel?
All right.
All right?
Yes.
Good. Comfortable and relaxed?
Reasonably.
Reasonably. Okay. All right. I wonder whether you'd like to share with us what some of those experiences were like.
I suppose the thing that surprised me most was that when I knew exactly what I was doing, or I felt I did, which surprised me. What I don't know is, when there was a business with my arm, what it did. I have no idea at all.
You mean when the arm lifted up?
Yeah. I don't know if it did lift up or anything.
Do you remember it lifting up?
No, I don't know if it did.
You don't know if it did?
No.
Ah.
Did it?
It did?
Oh.
Yes, it did very well.
But I do remember the other things.
Caroline, when you were hypnotized, would you say that the experience was under your control, or did you feel you were being controlled by Dr. Frankel? Or just what was that like for you?
I felt it was under my control, that I was selecting what I said. When he asked me about, I can't remember if it was exactly a happy experience, or a good experience. the sensation I had was of hundreds of happy events from my childhood going through my mind, and the problem was which one to choose, but that choice was very definitely my choice rather than something from the outside.
You seemed at one point to be a little upset. Can you remember something of that at all?
Yeah. Mm. It's surprising the event one selects, you know?
Would you not have thought that that would have been the event you would have selected?
Well, I think you asked me to select a happy event, and that wasn't a particularly... Well, it was, but it started off with a... I mean, it wasn't completely a happy event.
Sure.
Whereas there could have perhaps have been other events which would have been more solely happy.
Yeah. I suppose for a little girl of 9, having a baby sister...
No, it wasn't so much that. It was that when I woke up in the morning, my mother had gone, you know, because she had to go to the hospital to have a baby in the night. Yeah. And it's, I think, besides being a super day, because I longed to have this small sister, or as it turned out, there was also, I think, my moment of biggest panic in my life in the morning, just to find that my mother had gone before I knew where she'd gone.
Of course.
So it was a combination day.
Is that something that you often think about?
Yes.
Or were you surprised that you should have thought of it here?
Well, I often think of the panic bit, but I'd forgotten the pleasure bit of 5 o'clock in the afternoon when, or round about between 5 and 6, it was after tea, and my father came back and said that the baby coming, it was a girl.
Right, Father. So perhaps in some way then this has been able to reactivate for you some of the pleasurable side of that particular event.
Yes.
Oh, great. Great.
On a small farm in Lancashire lives a family doctor, Billy Bennett. Like many doctors, he has been worried about the limited effectiveness of many drugs, especially tranquilizers. For him, hypnosis has provided a welcome alternative.
I have only been farming recently, but due to the frustration of my job, about all of 10 years ago, I could have almost certainly given up medicine, chucked the whole thing up, until I discovered this new method of treatment, which has really brought so much satisfaction to me, purely and simply because I've been able to help my patients to cure themselves of so many very common and very handicapping conditions.
Here, in his general practice in Wigan, Dr. Billy Bennett will be working with one of his asthma patients, Mrs. Joan Sharman. With her permission, he will induce an asthma-like attack to demonstrate to her that it can be controlled without drugs. In the scene you are about to see, she has already been given the post-hypnotic suggestion that she will come out of the attack quickly.
Now just relax, sir. Okay, just relax very, very deeply now. Deeper, deeper. Let yourself relax very, very deeply indeed. Just relaxing deeply, breathing so easily and freely now, getting better and better and better, relaxing more and more. Deeply relaxed now. That's fine now. You're doing very well now. Relaxing deeper and deeper. Okay now. Deeply relaxed. Doing very well. Wonderfully relaxed now. Deeper, deeper. That's fine. Jolly good. Doing very, very well now. Breathing nice and easily and freely. Relaxing very deeply. Very deeply indeed now. That's great. That's a lovely feeling, isn't it? Deeply, deeply relaxed now.
An attack like this would normally be a real medical emergency, for which patients are often taken to hospital.
What started it all off?
But Dr. Bennett is finding that hypnosis is unusually effective in treating many forms of asthma.
Well, let's overcome that. Let's master that, shall we?
Yeah.
Okay.
Yes.
Just relax. Okay, well now, in a moment, I'm just going to count up to 7. And when I get to 7, I want you to open your eyes and join me here. And you'll feel absolutely fine, breathing wonderfully well, very normal, very happy now. Okay? Right, 1, 2, 3, 4, 5, 6, 7. Okay, good. Okay, and feel better?
Yes, thank you.
Oh, that's lovely, good. Well, I'm so glad because I want to talk to you about this because I think we can do a great deal. If you could do that by yourself, wouldn't that be super?
Oh, smashing.
Yes. So what about teaching you to do this for yourself?
Can you do that?
You see, you make up your mind that you want to, then by Jove, you will.
Yes, yes.
Okay. Well, now, I know you really want to get better, so this should make it very, very easy indeed. Now, just rest your head back on the chair, and I want you just to fix your eye on the spot on the ceiling. Can you do that? That's grand. And don't take your eyes away from that spot. Now, let your body and your mind relax as you breathe in and out, nice and freely now. I want you to imagine yourself to be walking in the countryside, breathing that beautiful fresh air, watching that spot very, very carefully.
Hypnosis depends on the imagination and ability of the patient, not the magical powers of the doctor. By directing Mrs. Sharman's imagination, Dr. Bennett first helps her to exclude distracting thoughts, then to relax, and then to begin to feel that she can control her own breathing and reduce her anxiety so that her chest muscles relax and breathing becomes normal. Having got used to the feeling of being hypnotized and controlling her attacks with the doctor's help, the aim in the future is for her to be able to hypnotize herself whenever she feels an attack coming on, and when she has calmed herself, automatically to wake herself up.
When you want to wake yourself up, all you have to do is to count from 10 down to 0, and you will open your eyes and join me here, feeling relaxed, confident, breathing wonderfully, freely and easily, and having no doubts and no fears and no worries. Well, I have that. I'm so glad. Now, look, it's so terribly important that you practice every single day for at least 10 or 15 minutes. And the more you practice, the better you get at this. And the more I will tell you what to do when we meet next time. So, would you like to make an appointment? I'll see you and we have a chat on that. Good,
Thank you very much.
Right, then.
Bye-bye.
Okay, right. Cheers.
Bye-bye.
Bye.
How widely applicable is this to the sort of conditions you come across as a family doctor?
Yeah. Well, I mean, it's not a panacea for all ills, and good heavens above, I prescribe as many pills as most doctors, because we've got a very busy practice here, and not all my patients want hypnosis. And I wouldn't dream of forcing it upon anybody. But when I come across a case such as migraine or an anxiety state or asthma, I always talk to them on these lines. They say, well, look, do you want the obvious form of treatment, lots and lots of pills, or would you like to consider a remedy that you can use and remedy your own problem? And most patients to whom I suggest this are very happy and very willing to cooperate. Not all by any means, but nobody must get the idea that this is a panacea for all ills. It's not. But it's a tremendous weapon, an additional weapon that the doctor can have in his armory to use at any time. You see, you never quite know when you're going to need it. In road accidents and even in accidents at home when the patient's in great distress, you can use hypnosis. The alternative, of course, is sticking needles into them, and you may not even have the drug with you in your bag. You may not even have your bag with you, which is a great... and you must never feel like a fish out of water without your medical bag. And if you have the ability to practice hypnosis, then you will always have a weapon.
Good morning, dental surgery.
The mechanisms underlying hypnosis are not yet properly understood, but their impact, sometimes on apparently untreatable conditions, can be dramatic.
I had a patient who came and sat in my chair, His face was covered with hundreds of eruptions. He suffered from psoriasis. This is a skin condition which is supposed by all the textbooks to be mainly a psychosomatic occurrence. Now this gentleman opened his mouth and he immediately started bleeding from about 20 different areas of his face. So I said to him, look, I can't give you dental treatment when your face is in such a mess and you must be suffering. And he said, I am suffering, but I've done everything I can to get rid of it. And I said, have you actually had any hypnosis or hypnotic treatment for this? And he said, no. Can this help? Because if it can, please let me know where I can go to have this done. And 6 weeks later, his face was like a baby's bottom. The skin condition in this particular case appeared to have been triggered off by a near-miss accident during the war. This gentleman had been a rear gunner in Coastal Command.
It was a night in the middle of August 1944. We were coming down southward from the Hebrides to land on our base in Northern Ireland, and we ran into a pea soup fog from sea level right up to 20,000 feet. By a bit of luck, we found our own aerodrome, and as we're coming into land, the pilot was letting down flaps, the radio operator was signing off, and I happened to look out of the porthole and saw this other aircraft coming at us about 80 yards away. I just had time to say, that's it, and it whizzed over our head, missing us by about 5 yards. Well, we got down and landed, and I can't really remember, it's so long ago. I must have taken some equipment back to stores. I should have gone for breakfast, didn't go, and I didn't eat for 3 days after that. And then about 10 days after that, spots appeared below my knees, on my legs.
Just how bad were they?
Well, perhaps this may give some indication. In the morning when I got up, I could have filled a soup plate heaped up with scales from the bed. And of course, as I went through my daily business during the day, scales kept falling. The skin kept cracking, bleeding, and things like that.
And what was it like to live with that?
It was almost impossible. There was no social life, no sex life. It was just a case of keeping going with what treatment was given to me and turning out each day to work best I could. Because I was bringing up a family at the time. I really didn't have much choice in the matter.
How did you feel about that?
Well, after 30 years, I began to accept it as a way of life. But now, instead of having it constantly, I have periods of clearness and followed by another attack. But I'm hoping that the periods of clearness will become longer and longer, owing to Mr. Smith's influence.
What did he tell you to do, and how has it helped?
Well, I think he taught me to relax. He calls it progressive relaxation. The more you practice this relaxation, the more effective it is. It sort of changes your attitude to life. Not that I was ever upset, or I'm quite easygoing, but deep down within me, I think I have been sort of tensed up ever since that night. And of course, the skin condition didn't help matters.
At the Winwick Hospital, Cheshire, consultant Godfrey Briggs, past president of the British Society of Medical and Dental Hypnosis.
I was a general surgeon for many years, in the course of which I did something like 13,500 operations. But I always had the uneasy feeling that I was dealing with symptoms rather than with people, and rather than with the whole complex, what you might call the whole man. I couldn't help feeling that so many patients came back with one condition, then another, and then perhaps another one. There must be somewhere in the background a common denominator which had an important bearing on the causation of these symptoms. And I became interested in the psyche as well as the soma. And the common denominator, of course, is the unconscious, because there are wishes and desires and mechanisms in the unconscious that we don't know anything about, and yet have a profound effect on our daily lives.
Dr. Briggs believes hypnosis to be one way of uncovering the forgotten events and painful memories that are sometimes closely associated with physical illness.
I want you to see a patient, Mr. Jones, who was referred to me by a consultant colleague because he's lost his voice entirely. He's a remarkable man, Mr. Jones, because he was a man who was very, very fond of his mother. He lived with her till he was about 40, did everything for her. He, I'm quite sure, prolonged her life. And nothing was too much effort for him to help his mother. Under hypnosis, we've discovered quite a bit about this man. We've discovered that one night he went out visiting, and he was a little late back, and while he was out, there was a fire at his mother's home, during which she was exposed to a good deal of smoke. A month after that, he was very distressed when she developed a stroke. And he felt very guilty about this because he felt that the fire was his fault. It wouldn't have happened if he'd been there. And therefore he was responsible for the stroke and for her loss of voice, which she suffered as a consequence of the stroke. This is rather fitting now. He feels that he should lose his voice as a punishment in expiation of his guilt. I want you to understand that this man is not suffering from mental illness. He's not mad or anything like that. This is a fairly common thing, and the causes of it lie in his unconscious, but they are very effective in the conscious. Hello, Ken. Good day or a bad day? I see. Well, I haven't seen you now for a week or two, so how have you been for the past few weeks? Any words coming? None at all. He hasn't spoken at all.
No.
How long is it since he's spoken to you?
Well, it's nearly 19 months, Dr. Briggs.
Is it?
Yeah.
How long is that? Time flies.
I think the sad part of it is I can't remember what he sounds like, you know.
What happens, Ken, if you make a very determined effort to say one word, if you try very hard? Try. Try very hard. Go on, grit your teeth and try really hard. Hard as you can. You don't get any response from your larynx. No. You know what you want to say, but you just can't. I should take up lip reading, shouldn't I? Is your wife a good lip reader? You don't mind if your wife hears you speak in the hypnotic state? Good. Well, just make yourself comfortable like you usually do. We'll put you into the hypnotic state. Relax. Just make yourself quite comfortable and let your arms and legs go very, very loose and just look up at that light. And breathe away deeply and slowly and let your whole body go slack. Now, Ken, I talked about being asleep, and so it seems logical that we can talk about dreaming. When I count 3, you're dreaming. You can be in this room or any place you like, and your mother's coming to see you. Now, when I count 3, she will be there beside you. 1, 2, 3. Hello, son.
Hello, Mum.
Nice to see you, Ken.
Good of you to go.
I wanted to come and see you. How are you?
No. Not so bad.
Good. Good. Are you perfectly all right, or is there something bothering you?
Can't speak.
You can't speak? Why not? Why can't you speak?
That's why I'm in this place.
Where are we, Ken?
I'm in prison, Mum.
Whatever for? What are you in prison for?
Laying you down.
Did you let me down?
Yeah.
And they put you in prison for that?
Yeah.
How long for?
5 years. So.
Do you know you've been speaking, Ken? Can you tell me
Only what you tell him.
I see, yes. Because you've been speaking quite well. Which shows that the voice mechanism is perfectly all right, you see. That's the important thing. It is the nervous, because of the nervous control due to tension in your mind and due to the conflict between your conscious and your unconscious is preventing you speaking. Your unconscious has persuaded you that you are guilty. You know that. You've told me this before, and so I can say so in front of you. And because you're guilty, you feel you ought to be punished. And a good way of being punished, according to your unconscious mind, is that you can't speak. It's a very fitting way. And it's very, very real indeed. There's nothing imaginary about it. Very, very real. So that you find that you can, and you will speak. I'm perfectly certain you will. And I will hear you speak again, and you'll be able to enjoy life together.
A year after that sequence was filmed, we returned to ask about the likelihood of Mr. Jones getting his voice back.
I think his chances are very good. He's beginning to show some signs of improvement. And of course, when one's dealing with the complexities of the human mind, time is of secondary importance. It'd be very nice to say that he had recovered his voice, but he hasn't. But this does not mean to say that he will not.
How valuable in this case has hypnosis been?
I think it's been very valuable indeed, because this man has had a great deal of chemotherapy and orthodox psychotherapy, orthodox psychiatric methods, with no result whatever. And now we are getting promises of improvement with hypnosis.
How, in fact, do you see your own role here?
My own role is that of teacher, in that I am enabling him to use his own capacity to cure himself. Remember that he is affecting the cure, not me. I'm merely guiding him. And I'm also a supporter to carry him through difficult periods. And I must make the point that I support him without making him dependent.
Do you see any dangers ultimately in...
There are dangers in the usage of hypnosis, mostly in symptom removal. Suppose someone had appendicitis and someone hypnotized him, removed the pain, then I think a fatality would take place. Suppose a patient had a headache and someone removed the headache by hypnosis, that patient might have a cerebral tumor, which would then not be diagnosed until perhaps it was too late. I think it's very dangerous. I feel very strongly about this. This is why I'm always saying that hypnosis or hypnotherapy should be in the hands of medically qualified people, because the hypnosis is easy. Anyone can do that. It is what follows on that is important and requires medical experience to do it efficiently.